Welcome to Aging to Perfection. I'm your host, Mel Seifert, Government Affairs for AARP Michigan, with over a decade of experience in the aging community. I'm here today with some special guests, so let's talk about me living in my pause era, discussing menopause. As women who are living in the pause area, this conversation is especially important. I know a lot of my friends are going through this. I know a lot of my colleagues are going through this. Every woman goes through this. So I think it's time to have this conversation and get it out in the open, and start learning more about how we can do better as we are going through this transition. So I have with me two very special guests. First, I have Sara Naylor Cramton, who is the OBGYN and a certified Menopause Society physician. So I'm really excited to have a conversation about what that is and what you do with that. And then I also have with us Jeri Whitehead, who is an RN with over 30 years of experience and just could not retire and had to get back into helping older adults and women go through this process. So we are so excited to have them both here. So let's start with Jeri. Would you mind introducing yourself?
Yeah, thank you for having me. I want to be straight. I tried to retire.
Everybody does.
But I failed. I've been a nurse for 34 years and worked in a variety of roles. I have a wonderful family and a second encore career as a nurse still, but loving it.
I love it. That's so great. You know, that's people find what they love to do. It's never work, right? I mean, it's just, ish, right? My dad said that to me, so I just always say it to make me feel better, but who knows? And then we have Sara here.
Hi, I'm Dr. Sara Cramton. I'm an OBGYN here in East Lansing at Alliance Obstetrics and Gynecology. I've been in private practice for 15 years, and I recently obtained my certification as a Menopause Society Certified Practitioner through the Menopause Society, which is an international organization of menopause providers. So I'm focusing on that a little bit more these days.
I don't think anybody knew that even existed. So we're going to get to that in a minute. So I was sitting on my couch watching the Today Show the other day. Maybe it was Good Morning America. But anyways, watching it, and I watched Halle Berry was on the Capitol Hill talking about the need for more funding from Congress to really look at menopause and what is going on in women's bodies and preventative care, if there is, but there's not. We just kind of go through this transition, and it is what it is. But really kind of understanding what changes in our bodies and how we can do better at kind of staving off some of those symptoms. And I just love that because I think it's one of the first times in a long time that I've ever heard menopause, the dirty M word, being spoken on TV. I think a lot of women, and especially my mother's generation, and please listen to the previous podcast on perimenopause that we have out there right now, talking about these issues, but not talking about them, right? Just kind of dealing with them, patting their brow or going in their room and slamming the bedroom door, whatever it may have been. But I really want to get to the root of it. So, you know, Jeri, with your 30 plus years in this world, talk to me about, you know, whether you've gone through something or you've had patients go through something. You know, what does this look like?
Yes and yes.
Yeah.
I may be somewhere in the pause,
yeah.
but we don't talk about it. There's so much stigma attached to it. And I'm not a man basher. I'm very happily married. But if this was a man's disease,
oh Lord,
would we be treating it differently? You've seen the memes about the man cold.
Right.
And, you turn on social media or television and it's erectile dysfunction, pill for that and pill for low T. You don't see as much about menopause. We're still kind of sweeping it under the rug.
Yeah, absolutely. And I think that's one of the frustrations and why, you know, aging to perfection is what it is, so that we can have these conversations and make sure that women that are going through this are able to have more resources and information and maybe feel engaged and empowered to have that conversation and give them tips and tools to do that. So Dr. Sara, if you wouldn't mind commenting on that.
I think we're at a really great time right now that everything is much more prevalent in the media. for better or worse, some of it is not the greatest information, but at least it's getting out there and it's giving people an opportunity to get more information. And I think, we live in a society which has always focused on men's health more primarily, and studies have been done on men, and it's really hard to get money into research for women's issues. So I think making that progress is a really big deal. We've recently had newer medications come out for menopause, which I think is a really big deal, and there are more in the pipeline, and I think we're at that point where we're really going to start to see some movement there.
That's so great, because I remember, when my mom was going through it, there was a lot of concern that a lot of the hormones you would take for menopause maybe, have adverse reactions, like cause more cancer or make you sicker. I mean, that's what's kind of ingrained in my head when I hear hormone therapy for menopause. Jeri, have you heard the same thing? Am I on a different world?
No, I think you're spot on. I have heard it. I've been counseled on it. There's a pill for that.
Right.
It's not a disease process.
Yeah.
And we look at it as sometimes an illness or disease. Are you suffering through menopause? You don't very often hear aging and perfection in the same sentence.
No, you don't. That's what we're here to do, though.
So, yes, we do hear the negative stigmas.
Absolutely. So what is out there right now? What can people do?
So we're seeing more and more people wanting to be on hormone therapy, on menopausal hormone therapy, which it typically includes estrogen and progesterone. There are people who are great candidates for it and people who aren't. So having that conversation with your physician is really important. There are, there are side effects and there are things that we need to take into account. It used to be that we would give people, if they really, really needed it, at the lowest dose for the shortest amount of time. Okay. And we're seeing now that there are benefits that maybe people can be on it for different reasons. Maybe they're on it a little longer than we expected. Some of the health benefits that we're recognizing are improvement in cardiovascular risk, if you're a candidate, questionable, benefits for dementia, also prevention of osteoporosis and colon cancer. There are risks associated with breast cancer, and so that's something we have to take into account. There are, if you're taking an estrogen medication and you have a uterus, you have to be on a progesterone to prevent endometrial cancer, and physicians will guide on that. But I think that we're seeing now more hormonal use, but also more medications that are non-hormonal come into play for people to alleviate symptoms if they're not candidates for hormones.
So what is a patient referencing, or what is my doctor referencing when they say, well, you're not a candidate for hormones, but we can do a bioidentical one?
So a bioidentical is a hormone. A bioidentical hormone is estrogen, estradiol, which is the same hormone that your body makes, and a progesterone. Typically, we use a micronized progesterone that is also the same as what your body makes. So using those medications feels better for people because they feel like they weren't, created in a chemistry lab.
Yeah.
One of the older medications that was used very frequently was called Premarin, and it was made from pregnant mare urine. That's how it got the name.
Oh my
and
God.
So people, really want to be on something more natural. That can come in multiple preparations. So I typically use a patch for people for estrogen. The estradiol patch is very effective, and we know exactly how much you're getting. And then a prometrium is, the typical hormone that I use for progesterone to protect the uterus, and that's a pill that you take typically at night. That combination works well for people, but it's definitely not the only combination. There are other medications out there. Some people feel great on it, some people don't feel great on it, and it's easy to make adjustments to get people the right fit for them. There's also a newer medication specifically for hot flashes and night sweats that's non-hormonal, and so we're using that more frequently.
That's good to know.
I think that that's another thing that you can talk to your physician about if you feel like hormones aren't right for you. Anxiety and depression are things that people notice. Some anxiety medications also improve hot flashes, so that's something that we can talk about.
Absolutely.
And I think that, lifestyle changes, like we always talk about, diet and exercise, always. But those things, as well as, mindfulness and meditation and yoga and things like that may not be a fix for your symptoms, but may make you tolerate them better. And so I think those things are important too.
So I recently had genetic testing done, which you can private pay for now. So I wasn't qualified for my insurance to pay for it, but I have to say, if you're able to do that and pay for it yourself, it was one of the greatest things I ever did. My mother passed away from endometrial cancer. And shockingly enough, I didn't have a target for that, but I had an increase target for getting breast cancer. So I'm going through a whole lot of not treatments, but just scans and extra mammograms. So my life is just incredible. So what do those treatments, how would somebody like me who's already predisposed to having, breast cancer, how am I going to treat, or somebody else out there with a similar situation, treat their symptoms for menopause?
Yeah, I think that's a really personal conversation to have with your physician, because there are risks and benefits to every treatment option. And I think having, for a lot of people, hormones aren't an option. And if because of your history that's the case, then going down a path of non-hormonal treatment is something that we would want to talk about. There are options for estrogen treatment for vaginal dryness and things like that don't really raise systemic levels. So you may still be a candidate for certain treatments, but having, it really is an individualized situation.
And that's kind of what menopause is in general, right? There's no, open up a book, point to the definition. This is when menopause starts. This is how it's going to look on you. Everybody's different, right, Jeri?
Right. And you also need a supportive environment, whether that's your husband, your kids, your girlfriends. You're not just screaming because you want to scream.
Right.
And sometimes you hear, things come out of your mouth and you're like, where did that come from?
Right.
That's not me.
Right.
Maybe it is you,
right.
But you can at least blame it on menopause.
Right. Listen. I the other day, my 11-year-old just was like, where's my shoes? Where's my this? Where's my that? And I'm like, for the love of God, man, and I just really went off. And my husband's like, whoa, that was an aggressive reaction. And I said, I am aware. I heard it and I felt it and I realized it. So, there is that, right? It's just, but there's other symptoms too, Dr. Sara, correct?
Yeah, I think that now that we're seeing more about menopause, lots of things are being attributed to menopause. And some of those are very, very accurate. And some of them are just aging, potentially. Joint pain. Yeah, you're probably going to have more joint pain in menopause because you're aging, and arthritis is a factor. And some of it may or may not be improved by hormones, but it doesn't all have to be menopause necessarily. I don't think that, we've always recognized all of the things that show up in this time in our lives. And I think that recognizing what those are and targeting them individually is sometimes necessary. So I talk about that a lot with my patients. What symptoms are you having? What thing is the most important that we fix right now? What things can we do to make you feel better? And then which of those things are maybe not related and need a totally different evaluation?
Other attention. So in the time that we have left, I do want to talk about the Menopause Society that you are certified in, because when you told me about this, I was like, the what? Is this like a sorority that I'm not aware of that I need to join? And it sounds like I do need to get on their website a little bit more. So could you please enlighten us?
The website is menopause.org. It's been around for a really long time. People may know it as NAMS, or the North American Menopause Society. They became the Menopause Society in the last year or two. And they offer a certification program. They offer a conference every year that is very well attended. It's in September, and I'm going to Chicago this year, and it sold out, I think, because there's just so much more information regarding menopause and so many more people who want to be available for their patients. So menopause.org is the website. You can go to that website to both find information and resources for patients and for practitioners. You can also find people who are certified menopause providers and people who are members of the society. So at least people who have that awareness. And I think that that's a great place to start.
Absolutely.
I think, paying attention to the books that you're reading and who's writing them and that they're coming from a reliable place is really important. Also, the one that I like the best is called The Menopause Manifesto by Jen Gunter. She's an OBGYN who's been a huge proponent for women's health for a really long time. And so that's what I typically refer people to.
Yeah, go ahead. I'm sorry, Jeri.
Do you think as healthcare providers we do enough to educate our patients about it?
Not until it comes up. It certainly isn't anything that, I'm I'm talking about it because that's what people are coming to talk to me about. And I'm talking about it much earlier because people are seeing it earlier. But I don't think that it's the expectation of when things are going to happen and what the transition looks like. I don't think the education is there. No.
I think we need to do better at that.
Yeah.
But the opportunity is sometimes hard to approach.
Well, I work for AARP, right? So I always hear out in the field and with my friends, they'll send me a picture of their AARP membership, and send it to me like, okay, enough, I get it, I'm older. I'm like, listen, what's the alternative, right? So, I mean, it's one of those things that, we have to go through it. There's the only way through it is through it. So I think these conversations are so important because, I was ignorant to this and I'm a female. I'm a woman going through it, right? And I don't think a lot of people knew the resources that were out there or that there honestly are, options to kind of alleviate some of your symptoms that you're having. Right. So I think this is a very hopeful conversation. And I hope that other people that are listening feel that way too. So, as we wrap up, just final comments from Jeri, our resident Encore career nurse. I'd love to hear from you.
Talk to your doctor about it if you're having symptoms. And if you're not comfortable, find a doctor you are comfortable with. Make a separate appointment. At this stage in our lives, a lot of us just go to our PCP once a year. We don't go to the OB-GYN anymore because your family practice doctor can do it all.
Right.
Make an appointment to talk to them about it.
Great.
And they can provide you so much reassurance that you walk out of there thinking, I'm not crazy.
Right.
I'm not. There is
help.
Right. These are symptoms that we can deal with. You don't get out of this life alive.
No.
So you might as well enjoy it while you're here.
You're darn right? That's amazing. So, Dr. Sara.
I think that it's just a great time in this stage of our lives where it's so prevalent and so much information is out there. I think, finding the right resources and taking the time for yourself to make that appointment and to come in to talk about what your options are now is the time.
Well, I just want to thank you both for your time again.
Thank you.
My awesome special guest today, Sara Naylor Cramton with OBGYN with Alliance Obstetrics and Gynecology. I almost got that out. I cannot say that for my life. And then Jeri Whitehead, who is our Encore nurse here today, talking with us with 30 plus years of experience. So once again, thank you for listening to Aging Perfection. Make sure that you like us and subscribe to any place you can find your podcast. So again, thank you so much. And remember to stay perfect.
Thank you. Thank you.